And then now we want to speak about substance abuse. So substance abuse, we can start by discussing the link between substance abuse and mental health disorders. Number one, there are common risk factors between mental health disorders and substance use disorders. You find that things like stress, anxiety will be on this list, that genetics, a family history of mental health disorders can also lead to substance use disorders. A family history of substance use disorders can also lead to mental health disorders. Number two, people with mental disorders may use drugs and alcohol as self-medication. So people with PTSD or post-traumatic stress disorder, people with anxiety, with depression, more often than not, will use substances to try and self-medicate to solve these issues. But in turn, they create even more problems from that use of illicit drugs or even use of alcohol. And then substance use can also contribute to the development of mental disorders. So you can see that the relationship between substance use and mental disorders is one where each of these things can cause the other. So substance use disorders can cause mental disorders, and as well as mental disorders can also lead to substance use disorders. And then more often than not, treatment for co-occurring mental health and substance use disorders typically will involve addressing both conditions simultaneously, because you can't really just treat one and ignore the other. You need to treat both of these things. And then now we want to discuss how one gets addicted to a substance. So addiction is actually a complex disease that is influenced by a combination of genetic, which means family history. If you're coming from a family where there is a lot of substance abuse, then your chances of also abusing substances are you're at a high risk. And then the environmental factors and developmental factors. So these are then things in our environment, things like poverty, maybe things like neglect, abuse, and so on and so forth. Things that affect us around us can lead to substance use disorders. It's important to note that the initial decision to take drugs or to take alcohol is usually voluntary, but then the repeated use then leads to brain changes that make it hard to stop or to control the urge. So when you start, it's voluntary. You are starting a drug, you're starting cannabis, marijuana, or you're starting cocaine or whatever. Initially, you make your own choice. But later on, because the body gets used to the high that's coming from the drug, the body can't do with it. So there are certain brain changes that where your brain is being rewarded. So for each take that you do, or for each sip or whatever, you sort of have a release of dopamine, which is like a happy hormone. So then for you to reach that same high, the next time you need to take, the brain demands even more for it to get the same level of dopamine release. So the more you do it, it becomes progressively incremental. So meaning that at some point, the body now can't do without. So that's how we then say you're addicted. Because if you don't have it, you sort of start to have symptoms of withdrawal, of intolerance, and things like that. So that's how we get substance abuse. So addiction is also is characterized by compulsive drug or alcohol seeking and use despite harmful consequences. It is considered a chronic disease because it can be difficult to treat and often involve cycles of relapse and remission. It's very difficult to treat substance abuse. It's so important that you make the choice not to start, because once you're in there, it's very complex. It's very difficult to start to convince your mind, backwards, to say, now let's go back. Let's go back to what it was before. Although it is possible, it is very difficult. It is a process that takes a lot of cycles of relapse and remission, like what we're seeing in the slides. And sometimes it takes a lot of weeks to months to even years to come back from an addiction. And then what are the negative effects of addiction? So the problem with addiction is that it increases your risk of cardiovascular diseases like strokes, etc. It increases your risk of kidney and liver disease. It increases the risk of contracting infections like HIV, STIs, hepatitis. So this here is as a result of maybe because of drug abuse, you sort of lose your inhibition and you can do anything. So your ability to negotiate for safe sex is taken away from you once you are under the influence of a drug. Your ability to think straight and to avoid to avoid sex, unprotected sex, or like promiscuity when you are under the influence of drugs becomes difficult. Not only that, but for other IV drug users, they also tend to share needles and all sorts of things. So that makes them at a very high risk of passing these infections that we've just talked about. It also weakens the immune system. So then you become vulnerable to getting any other kind of sickness that exists. It can lead to development of mental health disorders, which we've discussed already. And then alcohol, specifically, alcohol use can lead to a lot of short-term to long-term effects. So the short-term are dizziness, lack of judgment, loss of coordination, memory loss, vomiting, accidental injury. And in these short-term, people get into road traffic accidents, even work-related accidents as well because of alcohol intoxication. And then for long-term, you are at risk of getting diseases like hypertension with high blood pressure, diseases like heart disease, like stroke, like liver disease, and digestive problems. Also, it is associated with an increased risk of certain types of cancer, including cancer of the breast, the mouth, the throat, the esophagus, the voice box, liver, and so on and so forth. The list is actually long. So I think it is in your best interest that you do not abuse alcohol because of all these negative effects.